Already crowded emergency rooms are feeling the crunch following the closure of the ER at PeaceHealth University District Hospital. Thanks for joining us for KVAL News at 6. I'm Alan Matthews. Kendall Bartley and Brandon Cameraman have the night off. Following the closure of Eugene's only emergency room, patients have been routed to Springfield to receive care at one of the two facilities across the river. Today we're hearing from a veteran nurse who says the change is further overwhelming hospitals and their staff. KVAL's Bruhl has that story.
At the beginning of the month, PeaceHealth University District closed the doors of the emergency department for the last time.
We knew we had something special.
Kevin Paul worked in the University District ED for 25 years, and now, like patients in the state's third largest city, she heads across the river into Springfield for an emergency department.
Part of the waiver was waiving those emergency medical services that are required as part of a general hospital license at the University District location. Those are going to be provided at the Riverbend location, as you mentioned.
So now, at this point, Paul and her colleagues are learning to care for patients in a new environment. And even for nurses with decades of experience, that transition has its challenges. Paul says those challenges lie in the learning of a new system.
It just takes longer to do something. It also adds up in a frustration level and a self-confidence level.
That impact on self-confidence is compounded, Paul says, by the increase in patients coming through Riverbend's doors.
The lobby is full. The beds are always full. It feels chaotic to me.
Within that chaos, nurses are finding solutions, but even those solutions feel like short-term band-aids rather than long-term fixes.
We are providing care in the lobby as much as we can. And sometimes people are discharged from the lobby. And that in itself feels chaotic.
Currently, there are no public plans to change how emergency care is provided here in Lane County. Waivers issued by the Oregon Health Authority allow for continued use of some PeaceHealth resources in Eugene. Part of that process means an evaluation of how healthcare options have changed will take place in 2024.
OHA is requesting information from PeaceHealth to report on those patients, type of patients they are, how they present, so we could follow up in a year.
In the meantime, it appears that nurses and patients in Lane County will continue to work with what they have.
It's scary for the nurses because it only takes one person for that to absolutely come crashing down, and we don't want to see that. We're there to take care of people. We don't want to see people hurt.
Reporting in Eugene, I'm Zach Bruhl.
Now, we have heard from nurses at McKinsey Willamette as well. Off camera, they have confirmed to us that wait times and patient ratios have increased since the beginning of the month. This is a developing story. We will continue to update it as we move forward. Of course, you can head to our website to see our previous coverage of this story.